Hello everyone, myself Dr. Mahendra Sharma, a urologist from Indraprastha Apollo Hospital, New Delhi. I want to share some brief information about BPH patients during these difficult times of COVID-19 pandemic. The most of the patients of BPH are elderly gentlemen and having low immunity as well as other comorbidities. So they must restrict their out-of-home visits to the chemist or to the hospital. They must take adequate amount of liquids during the daytime as this is the summer season and must restrict the fluid intake after the 7 p.m. or during the night. Patient must take all the medication regularly without any halt, and patient can take telephonic or video consultation to the doctor for minor ailment or any aggravation of the lower urinary tract symptoms. The relative indication of surgery can be delayed for a couple of months or till the situation in our hospital will get better, and patients on catheter will be do proper care of the catheter at home, or they can change the catheter at home regularly under oral antibiotic cover by trained staff. The brief information about the patient who are undergoing prostate surgery, which may be TURP or HOLAP during this time. The spinal anesthesia will be preferable as compared to general anesthesia, as we know the aerosol generation is very important factor in the spread of this infection. Number of person standing inside the operation theater will also be minimized. Operating surgeon must wear all personal protective equipments to prevent any possible risk of infection, and hospital stay must also be minimized during these difficult times, and patient can be discharged on the Foley catheter with proper education about catheter care, and catheter can be removed by patient himself or by trained staff which can be called at home later after the discharge. The biopsy report can be collected online and that can be discussed with the doctor on telephone or by mail or by video consultation. Thank you so much. Take care.